WHO has been sharply criticised by the United States and will be the subject of an
are going to be
inquiry.
higher risk people, and you are more likely to get positive results, in that population. But
at least a dozen states pushing forward. New models suggest the country could face a major setback if change comes too soon.
I think it probably does grow so quickly. One of the key questions will be what was the animal source of this virus? We understand that it came from a fish market, an animal market in Japan. We don't know what was the animal source of it. That is something that would be looked into as well. It was very
determined our fate.
At least a dozen states pushing forward, as new models suggest the country could face a major setback if change comes too soon.
Our forecast now.
What is COVID? Coronavirus is a type of virus that attacks the upper respiratory system from mild to moderate, such as flu. However, some types of coronavirus can cause some serious illnesses such as Middle East Respiratory Syndrome or MERS-CoV, severe acute respiratory syndrome or SARS-CoV, pneumonia, coronavirus disease or COVID-19. How is the transmission? Coronavirus can transmit through cough, sneezing, touch the hand of an infected person, touching the eyes of an infected person. As a result of being exposed to COVID, if you was infected coronavirus, you can isolate it in the hospital if respiratory disorders such as pneumonia, heart disorders such as heart disease, kidney disease, and the worst, coronavirus can cause death. What are the symptoms of COVID-19? Symptoms of COVID-19 include fever, cough, shortness of breath, but in more severe case, it can cause pneumonia. Now, these symptoms are similar to influenza that is more common than COVID-19. What is the treatment for COVID-19? At the present, there is no vaccine to treat COVID-19. But from the symptoms can be treated by get treatment from a healthcare provider. Now, then there are steps that can be taken to prevent the spread of COVID-19, including keep in the house, cover mouth and nose when coughing or sneezing, wash your hands with soap and water, clean objects that are frequently touched, and the last, physical distance. The outbreak of coronavirus disease or COVID-19 has been declared a public health emergency of international concern or PHEIC, and the virus has now spread to many countries and territories. We don't know that it is transmitted through direct contact with respiratory droplet of an infected person. Individuals can also be infected from touching surface contaminated with the virus and touching their face, especially eyes, nose, mouth. While COVID-19 continues to spread, it is important that communities take action to prevent further transmission, reduce the impact of the outbreak, and support control measures.
The coronavirus pandemic isn't just raising the specter of recession. Economists are worried about the possibility of something even worse.
Everybody stays home for 6 months, then it's hard to. It's going to be like the Great Depression.
So what's the difference between a recession and a depression? It comes down to how long the economy contracts. A recession is typically defined as 2 negative quarters of economic growth, and is part of the normal business cycle. The U.S. economy has fallen into recession more than 30 times since 1854. A depression is something vastly different. It happens when the economic decline is sustained and might potentially go on for years. Now, that's only occurred once in American history in 1929, and it lasted 10 years. Because it lasts so long, a depression is more severe. A decade ago, unemployment hit 10% during the worst of the Great Recession, but during the Great Depression, the jobless rate peaked at nearly 25%. The reason economists are so worried this time, we just don't know how long we'll be fighting this virus. We don't know how long stores will be shut down, how long travel will be paused, how much damage will be done to supply chains, or how many companies will go bankrupt. But there is hope if you look to history. The recession that followed the 1918 Spanish flu pandemic lasted just 7 months. That's much shorter than the average recession. Let's hope this time history repeats. Small businesses have been ravaged by the coronavirus and the economic chaos it has caused. Now the government is ready to help. The stimulus package allocates almost $350 billion for forgivable small business loans. Who is eligible for those funds? Generally, any business with 500 employees or less. That includes independent contractors and sole proprietors. The loans are designed to keep businesses afloat. Businesses are eligible for 2.5 months of payroll costs based on the average cost from last year. And the loans do not have to be paid back as long as owners meet a few conditions.
Businesses have been forced to close and citizens isolated at home on an unprecedented scale worldwide. It's caused a unique economic crisis, the impact of which will be greater on some industries in particular.
The industries which are hit hardest are those which are related to the consumer. So that's retailing, that's entertainment, that's hospitality, both hotels and restaurants, many of which have simply been locked down. And many of these companies will have high costs, which they'll need to keep meeting. So suddenly you have lots of costs continuing and absolutely no revenues, which is the worst possible outcome for these businesses.